Okay, this is a really big and very important question, whether there's any mental health diagnosis that can be misdiagnosed as gender dysphoria. For starters, keep in mind, I work with adults. And in my experience, primarily people I tend to see tend to be aged about, I would say, 25 and up. And because they're older adults, they have already done a lot of their own insightful investigative work into their gender. And by the time they come to see me, they're pretty certain about their gender identity. So I seldom personally see people in that adult category being misdiagnosed. Now, also keep in mind that I'm somebody who's only specialized in transgender issues. So for me, personally, diagnosing gender dysphoria is relatively, how should I say it? Well, I have much more experience to diagnose it. But that does not mean that other clinicians that are less skilled or maybe working with even younger population cannot actually make a mistake of misdiagnosing something with gender dysphoria when in fact it's something else. So let's look at the common potential misdiagnoses that could be diagnosed as gender dysphoria, but in reality they're really not. Body dysmorphia comes to mind, right? Because it's so closely correlated in terms of how we feel about our body, to, for example, feeling a dysphoria about your body. So body dysmorphia comes to mind. Another misdiagnosis that comes to mind is some form of severe diagnosis that maybe has not been assessed with individuals. I'm also thinking about severe traumas. Severe is the operative word here. Perhaps like a severe sexual assault trauma or some other type of ongoing trauma dating back to childhood or maybe young adulthood. Those things, if not screened properly, may lead for individuals to disregard or negate their gender assigned at birth. Some other things that tend to come to mind as I think about it is people who feel very strong ideological views about misogyny, about toxic masculinity, those type of things. For a lot of those individuals, in my experience, but I've seen them very rarely, it was more a matter of gender expression and gender role, meaning they really needed to modify how they express themselves and feel much more comfortable about their expression versus really modifying their physicality or modifying their body. So those are the only ones that really comes to mind, but I seldom see it myself with adults. It does not mean that that does not happen. I'm sure there are cases where people have been misdiagnosed with gender dysphoria when in reality it maybe had been something else going on. This is why we need more clinicians who are more specialized. So this is why we need more research. This is also why we need better tools to be able to screen for gender dysphoria, apart from just reading the DSM criteria for gender dysphoria. So hopefully that clarifies.